A number of years ago, I was at a conference and I was asked, if you're an age management physician, how do you measure the aging process? So I started to research what literature there was on ways to measure the aging process and found that there were quite a few that weren't really being implemented in clinical practice. They were being used for other things, so they are fully validated technologies, but not used to track the actual aging of the major systems in a human body. There's somewhat of a learning curve to getting started in age management medicine, working out protocols, training in the biomarkers of aging. So we make that easier for somebody who's just getting started so that they don't have to go through the 3 to 5 years that it took for us to start to develop our system. We help them put together the patient flow, follow-ups, forms that they need, and then we have our online system of biomarkers that allows a patient to know what their physiological age is, or what we call the physio age, which took us many years to develop. It's a software web-based system. We find that if you're going to be doing the full age management medicine, it's best if you become integrated with all our protocols. And then what's really important is to have backup when that difficult case comes in. 90% of the time you're going to be able to handle things, but if you have someone with 15 years of experience helping you manage a patient that may be a little bit off the normal response, then that's very helpful for doctors. This type of medicine is the medicine of the future, and that helping people stay healthy rather than focusing on disease is really what health care is all about, rather than disease treatment. And then I also tell them the first place to start is to understand where each individual is in the aging process. I like to say the first step to aging well is knowing how well you're aging.